Good afternoon. Thanks for joining us today. My name is Ben Miller. I'm the Chief Strategy Officer for Wellbeing Trust, and you have found yourself in a Healing the Nation webinar. We've got a good one today for you folks. In partnership with Civitas, Wellbeing Trust is trying to do these at least once a month on various topics that we think really pertain to how our nation can better address mental health. Today's is a little bit of a curveball. It's a doozy because we're going to be talking a lot about media and the role of media within how we are talking about mental health during times of COVID. So before we get going here today, just a few housekeeping notes. First of all, everybody's muted. You've probably realized that by now. There's nothing worse than the awkwardness of a car honking or a dog barking in the background when we're trying to get through some pretty important presentations. So if you have questions or you have things that you want to comment on, please do so in the chat function, and we will make sure to monitor that and ask our experts today those questions when we get to the end. Second of all, we're recording. So if you don't get to watch all of this today, we will be posting this online and you can get back to that at your own convenience. We also ask that you share this around. We're going to be doing these, as I said, monthly, and we are always looking for folks to join us in our crusade. So that being said, let's get into today what we're going to be discussing. We have a pretty all-star stellar cast. And if you can see here on the slides in front of you, we've got folks that represent all kinds of different angles on mental health and media, especially during time of COVID. And so rather than tell you all about these amazing people, I'm going to let them do the talking themselves. But let me tell you who we've got. First of all, we've got Sejal Hathi, who's a physician, and we'll be talking a little bit about her experiences, not only on the front line, but also her experiences looking at mental health and media. And she'll tell you a whole lot more about that. We've got my good friend and colleague, Jayne who's going to be talking about some of the work that she's doing, which is very exciting and probably going to be, one of these things you have a lot of questions about. And then alongside her, we have an amazing presenter in Heaven who's joining her as a student, because we know as a part of these series that we've got to have the youth voice in here. So we're really happy to have Heaven join us today. And then closing us out is a good friend and colleague, Gorenstien, who's going to be talking a little bit about that wonderful thing that most of you probably use more than you care to admit, podcasts, and how podcasts have become a way to really get good information out there to a lot of folks. So that being said, let's go ahead and get started here. Just a few comments off the top. One click of the computer, and you can see that there's articles reaching far and wide that speak to the impact of mental health during COVID-19. It's having a pretty profound impact on our mental health. In fact, even today, there's new data showing from Kaiser Family Foundation that 1/3 of Americans now, this is a different study. I've got two studies here. There's one study out today that shows that 1/3 of Americans are showing signs of clinical depression and anxiety. That's a lot of people. And then in the new Kaiser Family Foundation tracking poll that's out today, nearly 4 in 10 say that worry or stress related to coronavirus has had a negative effect on their mental health. And you can see also in the Wall Street Journal today, there's an article on our caregivers, those on the front lines, and how hospitals are really fighting to provide mental health supports to their own workforce. So no matter where you look, issues of mental health are there. And in some ways, COVID-19 has helped us all understand mental health just a bit differently than we have before the virus. But like in the past, we've not yet capitalized on this awareness to move our country to action. And that's part of the reason why we're doing these webinars, is we do want the country to move to action. And as we've discussed on previous webinars, the collective impact of COVID-19 could be devastating. 3 factors that are already at work, which we talked about in a previous webinar: economic failure with massive unemployment, mandated social isolation for months, and possibly residual isolation for much longer, and this uncertainty caused by a sudden emergence of this new novel, previously unknown virus. So it's 2020, and we're in a moment that few of us will forget. As mentioned, Kaiser Family Foundation has been tracking how the public feels about COVID-19 and its impact on our mental health. And while we're all experiencing things differently, it's clear that this has been a pretty stressful event for us all. So in collaboration with KFF, there's some great, Wellbeing Trust has put out some great resources out there on mental health and COVID-19 that you can Google to your heart's content. Next slide, please. And this is your daily reminder that Congress has not yet put resources behind this problem. If you didn't know these data, now you do, and you got to do something with this. The CARES Act, which was that $2 trillion relief bill that flew through Congress, literally flew through Congress, included a whopping $425 million to SAMHSA in there for mental health. While this investment is indeed welcome, it's almost like SAMHSA's entire budget for a year, it also underscores the dearth of official interest in this vital area. For reference, $425 million is less than 1% of the total amount invested in the airline industry, and an even smaller fraction than $185 billion that went to hospitals and healthcare providers as a whole. So it gives us an opportunity to really tackle this issue and talk about it in new and exciting ways. And that's where we come in. We've got to have a vision for excellence, something that can spur us all to action. We've got to use language that reinforces the importance of making sure that mental health can be addressed everywhere. Not just in the traditional places that we're used to, but how to normalize mental health and change the narrative that it's not just about, one in however many, it's about all of us. And if anything, COVID has highlighted the fact that really this is about all of us. But without a comprehensive framework that sees mental health as existing on a continuum that begins in community and extends into healthcare, we run the risk of tinkering at the edges or sliding back into mediocrity, kind of the way it was before. So let's embrace a new norm when we can bring mental health to the places that people are. As colleagues and I published in The Atlantic recently, COVID-19 has shown many of us the good and the bad facets of a nation in a time of crisis. And much of what people are discussing is what they see on TV, they read in the paper, or they hear in a podcast. Today's webinar is special. It's special to me because I've got friends on that I have a lot of respect for. But we've invited names and faces who mean a lot in how we talk about healthcare, whether it be policy to mental health to just the stories on the ground and so much more. So we've laid out this webinar to really highlight 3 different media perspectives on mental health during COVID-19. Each one of our amazing speakers could be a standalone speaker for the entire webinar, and I do mean this, they're all phenomenal. However, for today, we've asked them to keep their remarks short to about 10 minutes each so that we can get to our Q&A. So we're gonna start with Sejal Hathi, a physician who is gonna talk a little bit about what we're seeing on the news, what she's seeing in the hospital, and what gives her hope. From there, we're gonna go to Jayne O'Donnell, who is a phenomenal reporter at USA Today, who's gonna be telling us a little bit about the mental health coverage in a pretty saturated news environment. So give us some top lines from the reporting, but also tell us about this wonderful project that she's involved in called the Urban Health Media Project. And we've got Heaven, who is really gonna be able to talk from her perspective as a youth about mental health and how it's impacting her and her peers, and what role media plays from her perspective. And then finally, we're gonna close out with Dan Gorenstien, who's gonna describe a little bit about the urgency of mental health coverage and what he's doing with his podcast Trade-Offs, which if you haven't listened to is a must listen, and how he's advancing mental health through that agenda. So without further ado, it's my pleasure to turn it over to my friend and colleague, Dr. Sejal Hathi. Sejal.
Thank you so much, Ben, and thank you, Civitas and Wellbeing Trust, for having all of us here today convene to undertake this important conversation. So hi, everyone. My name is Sejal Hathi, and I'm an internal medicine and primary care doctor at Massachusetts General Hospital in Boston. What that means is that these past 2 months, my day job has consisted chiefly of caring for COVID-19 patients in our hospital's ICUs. But a reason Ben asked me to join you all today is that I have also had the privilege of sharing my experiences and my views as the occasional commentator on the television media. I will be the first to concede I am not a journalist, but to a degree not witnessed perhaps for years, the voices of scientists, epidemiologists, and health workers like myself have been ushered with open arms into the national dialogue. To a degree not witnessed for long, our ideas now carry weight. What we say reverberates deeply because we are all occupying in some form the front lines of this crisis. And for that reason, it matters greatly which issues we choose to emphasize and which we ignore. So I thought I would spend my few minutes with you here today exploring firstly, which mental health issues we're seeing discussed most heavily in the news media, which ideas and challenges I'm seeing, perhaps by contrast, on the wards, and finally, what gives me hope about the attention and coverage afforded mental health issues in the future. So if we could go to the next slide, please. Thank you. So I have here gathered a number of news clips from various networks about what we're seeing covered most frequently in my view. So firstly, you can see in the top left corner, we're seeing a ton of stories about personal protective equipment shortages. And, this is an incredibly important issue. And I myself have taken to the television airwaves to inveigh against what I perceive as our government's callous policies and broken supply chains that have rendered us so woefully ill-equipped to protect our frontline workers. But to date, this issue has been discussed chiefly as exactly this, yet another example of how our government has failed to act responsibly in this crisis, and how the danger and uncertainty that has ensued make our healthcare workers heroes for plowing ahead in spite of this. And as vital as this point is, it does exclude discussion of some of the mental health implications of these policies that I think are important to consider and to discuss. Secondly, we're also seeing a number of stories about the testing deficiencies in our national response. More than 10 weeks after this pandemic first captured the national psyche, we're still testing too few Americans to curb the pandemic. Experts say, upwards at least double the number of tests, 250 to 275,000 is what we averaged, I think, this past week a day. At least double that. It will be necessary to appropriately curb this pandemic, and we have no national strategy. We're also seeing a number of stories about nostrum medications like hydroxychloroquine and the other anti-malaria drugs that are being trumpeted by our president and perhaps others in the absence of data. And though the thrust of these stories has been either bewildered, emphasizing the president's quote, stunning, as you can see in that clip, disregard of the evidence, or wry, playfully admonishing the public not to attempt ingesting these drugs, chloroquine or bleach or others, for in themselves to ward off the disease. I think that there are serious additional consequences of the current discussion that we're not quite considering. And I can say that I have had several patients and families who have called me relentlessly asking for prescriptions for these drugs, asking if they might commence taking these drugs. And I have, and my colleagues have treated not a few who have unfortunately overdosed on these same medications, or in one case, actually very recently, have, in a perverse consequence of the media frenzy around Trump's comments, deliberately ingested one of these medications in an attempt at suicide. So I think that there are unfortunately a lot of consequences of this discussion that perhaps we're not paying heed to as much as we should. Speaking of suicide and the broader implications of this crisis for Americans' mental health, in the last couple of weeks in particular, we've begun to see increasing coverage on television of the rising risk of the full continuum of mental health disorders and how to deal with them at home. We're seeing here Chris Cuomo talk to Deepak Chopra about meditation, among other behavioral and lifestyle practices that we might consider adopting to better care for ourselves. You know, on the right, we're seeing Anderson Cooper talk to various experts about how to recognize the warning signs of suicide at home. And this is an important discussion, as Ben alluded to as well. We know that nearly half of Americans are reporting negative impacts to their mental health from the Kaiser Family Foundation. We know that, you know, federal emergency hotline for people in emotional distress recorded a more than 1,000% increase this past month compared with the same time last year. So I think it's important that people are talking about this, but I also think that we need to dig in a bit deeper. Next slide, please. Next slide, please. Thank you. So that brings me to what we're talking about, or rather what I'm seeing on the wards. So the ideas and the challenges that my colleagues and my patients are wrestling with that are not perhaps getting their due. And the first thing I want to talk about is health workers. So in the midst of this pandemic, as mentioned, we've discussed relentlessly the urgent and vital need for more personal protective equipment, for more testing, for more ubiquitous masks, outside and adherence to social distancing guidelines, but too few people are talking about the simmering mental health crisis facing our healthcare workers, like myself, on the front lines of the pandemic. By the general public, we are celebrated as heroes without capes. We are applauded as fearless for plunging forth into the depths of disease, as selfless for sequestering ourselves for months from our families. We are compared to soldiers hurtling forth into battle without the armor to safeguard our bodily health. But what the public and what the media, particularly the television media, I think podcasts, as Dan can probably attest to, and Jayne can as well with the print media, have done a much better job of covering this issue. But what the public and the television media overwhelmingly miss is that we didn't ask to be heroes. I have a quote from a colleague of mine, Dr. Yermali, that I've pictured here on the slide, that said, that comments on how, what a burden this is to have to be compared to soldiers when we never asked to be soldiers, and be expected to stand tall by virtue of that comparison, and to fit that mold. Tucked within our homes and hospital workrooms, we are scared. Many of my colleagues are, cry, we're angry, we're toxically tired. The lack of PPE levies not merely a physical danger, but a psychological toll as well. Over 10,000 US healthcare workers have already been infected. Dozens have died. Many of my colleagues still in their 20s have composed living wills, and meanwhile, hospitals are muzzling others who choose to speak out about PPE shortages. I think the emotional tax of COVID-19 is difficult to predict, but history suggests that these acute stresses can snowball into anxiety, depression, PTSD that linger for years to come. One study of health workers at the center of the 2003 SARS outbreak showed that 89% developed psychological effects. And another study affirmed that these later developed into PTSD. We saw 1,200 doctors in China who were surveyed at that country's peak, and 50% of them reported symptoms of clinical depression. And we must remember that this is a profession long pummeled by mental illness. Already prior to the pandemic, 50% of physicians were affected by burnout, 30% of trainees by clinical depression. So this is already a high-risk population. And so I think it's important to recognize that while apotheosizing doctors as heroes is well-intentioned, we should not deny them the space also to be human, especially on the air. I also want to talk about briefly the impact on vulnerable communities. While COVID-19 has been in some circles been termed a great equalizer, we know now from anecdote and data that its impact is profoundly shaped by social inequalities. Infection rates are 3 times higher in predominantly Black counties than their white counterparts. Mortality rates are 6 times higher. And we also know that frontline industries are disproportionately female jobs most likely to be affected by layoffs are also the ones held by people least able to afford losing a paycheck, and such job loss and the the stresses of impending job loss lead to higher rates of depression, anxiety, suicide, and substance use disorder. And so the pain, while felt by all of us in this pandemic, is magnified among the most marginalized of people. And I think that it's important to highlight their stories as well. People with addiction are also particularly vulnerable. They're more likely to contract the illness by virtue of a variety of social determinants, and more likely to suffer severe disease if and when they do. The social context that we're now in, dominated by self-quarantines and social distancing, also places people with addiction at risk of relapse. Our clinics here at Mass General focus on harm reduction, which means working with people without judgment and striving instead to mitigate the worst outcomes of drug drug use. Typically, we send our patients to meetings led by peer coaches where they meet also with specialized nurses and certified providers for support and for medication to treat addiction. If they are not ready to stop using, we urge them at the very least to take precautions like obtaining clean needles and using when others are there, not using alone. Unfortunately, now they're being told to stay home, often alone. Clinics are closed. Many methadone clinics have closed. Many patients, even when the government has relaxed guidelines allowing patients to receive methadone at home, I have a number of patients who have not been able to get that methadone at home or to start it because clinics are closed. And I have one of my colleagues, Dr. Aguelo, a quote from her there, and she suffered the loss of one of her longstanding patients who she was not able to start on methadone and who was found dead at home. And she wonders, what if he had been able to start it? What if someone had been there with him, if we weren't in this era, who could have administered naloxone on time? So substance users are under a lot of distress right now. They're not able to go to these meetings. A lot of them in our community are meeting in secret. There's a group of folks in Charlestown who are meeting in a nearby field, sitting apart on bleachers, attempting to sit 6 feet apart and use sanitizing wipes against government recommendations, because that's just what they need to do. I think for people with chronic diseases, simple but essential services have also vanished. People are not able to, get their blood pressure checked or follow up on their diabetes medications. One of my patients discovered, I quoted her here on this slide, a breast lump, and she's petrified. She's already suffered breast cancer once. She knows she needs to get it checked out. She's been waiting for 2 months already, and yet she's petrified of coming to the hospital because she's already elderly and is worried that she'll contract the disease. And these are the stories that I wish we could talk about more. That the people, the second pandemic, the stresses that a lot of these people are suffering because they're not able to get the care they otherwise would have. You may tell me telehealth is an option, but we know that particularly Americans who are older, who are lower income, who are suffering serious mental illness, lack video conferencing capability. 21 million to 42 million Americans per the FCC lack broadband access. More than 1/3 of the poorest people making less than $25,000 a year don't have access to telehealth. So this is not a solution, even as it has done a lot for mental health care access. In particular, this is not a solution that impacts everyone. And I realize I'm far exceeding my time, so I will say one more thing about Asians, and very quickly, a lot of my colleagues have begun to, as many others across the country, face bigotry, and we know through something called race-based traumatic stress disorder that bias and bigotry like that being experienced by our Asian American colleagues can can lead to long-lasting PTSD, and I think the effects of that should be explored and discussed some more. Next slide, and I'll be really quick with this. So I just wanted to say that what gives me hope is that for the very first time, we're starting to see celebrities share their stories. People across the country are beginning to strip the Instagram perfect facades and be vulnerable with one another and talk about, for the very first time, how mental health is inextricable from physical health. You can't talk about PPE without talking about, and the lack thereof, without talking about the psychological toll. You can't talk about being isolated from friends in quarantine without talking about the anxiety that induces. So what I'm hopeful is that this moment will be galvanizing enough for the public and for our policymakers alike to recognize that the system is broken, and there is an urgency like there never has been before to doing something about this and ensuring that more Americans have access to affordable and generous mental health care, because otherwise we're all screwed. Thank you.
Thanks so much, Sejal. That's a tremendously insightful presentation. We appreciate not only your service, but also your insight into issues that are impacting us all. So thank you so much. We're going to turn it on to Jayne. Jayne, take it away.
I think I'm unmuted.
There you go. We hear you now.
Okay. Thank you so much. I am a member of the media and have been for several decades, since the 1980s, but I will be one of the first to say that we sure don't get it right all the time, and it's not getting better as the years pass and the industry shrinks and the competition grows with the internet. But having said that, I feel that I'm in a position to work from within, and I actually love that. I mean, I wouldn't still be working with, because talk about mental health. There's a lot of stress in this industry, but I have to mention though that one of my very first concerns about mental health was the stress I believed we, the media, were creating in February when we were writing so much. We were writing so much about this. I thought we were getting people all geared up for not nothing, but that we were kind of overplaying it, because we are certainly known for that. Kaiser Health News, I remember a former colleague, Liz Szabo, wrote a story, comparing it to the flu, and there's, much has been said about how little we pay attention to a typical flu, and the media focuses on whatever the shiny new thing is. And I'm not, I also, speaking of podcasts, I've just gotten addicted, and I don't use the word addicted lightly, but to Conan O'Brien's podcast. That's one of the things that's getting me through the pandemic. And they use a term where they say name drop, and I'm doing a name drop thing, but I was sitting next to Tony Fauci at an editorial board the third week of February. And I all of a sudden felt better, because he was saying publicly, like we did a video and it was on the record for the editorial board, that not to worry, really. I mean, but that is what he said the third week of February. And I wrote that story and personally felt better, and kind of, we some colleagues and I grumbled that here we were making too much of this when Tony Fauci says this. That's an example of something I know Heaven's going to reference, that there's kind of misinformation and recycled old information, because when we talk about, what my top lines are, I'm going to talk a little bit about the stories that have done well, those stories that are most popular. And that story has had a second life and gone viral. And it was, a certain conservative television network has, had it on and played it. That, see, Tony Fauci said that, this isn't a big deal back in February. So that's, so things have now come the other way. So I started by worrying, we were worrying people unnecessarily. I do worry very much that in addition to all of the social isolation that creates mental health challenges and exacerbates the challenges I already write about, that we have a situation where we are writing about it all the time, and it kind of, are we making it worse? I don't know. I feel better, and I know that Ben and many in the mental health community worry about, that mental health wasn't getting the attention that it deserved. I feel better for all of us that we're starting to be able to write about other stories. It is true, almost everything, if not everything, actually everything needs a COVID angle right now. It really does. But unfortunately, or fortunately for a news reporter that wants to write about something other than testing and vaccines, all of the things that I covered before, the domestic violence, the trauma, the mental health issues, the addiction, are getting worse, and that's a story. So there is an angle. There is a way to find an angle. It's proprietary, so I can't give you numbers. I'm sure it's proprietary, but I can see the traffic that all of my different stories get, and I peeked at it again today. And I remember when I wrote about, it was March, I believe, and I had to make a strong case that I should be writing about this new study that was out on Alcoholics Anonymous, the first study in forever looking at the effectiveness of Alcoholics Anonymous. And I didn't even mention COVID. I didn't have to, I thought, because it was Alcoholics Anonymous. And it's one of my I think it's like in 6 months, my 6th most popular story. And I've written a lot of stories about coronavirus. So there were a lot of people probably Googling Alcoholics Anonymous because they were watching how much their husband or wife or child were, in withdrawal or drinking or whatever. So the finding the COVID angles is not that hard. And that it's both the good news and the bad news. So and by the way, Ben and I have spoken about this. It isn't one of his core issues he focuses on, but I did finally get to a story on Saturday, or that posted Saturday, about obesity, which, you know, when there is this compulsion to eat so much, you know, I've often thought of it as you know, a form of an addiction or a mental health issue. But, you know, just the effect, you know, when people who are very overweight, you know, in the obese, morbidly obese category, you know, what it can mean for them to get COVID and just generally be treated in a hospital. That story did really, really well. And I think I'm going to be talking about it tonight on MSNBC, as a matter of fact. But so these are the stories people really read. And by the way, number 3 of the whole long list of stories I've done in 6 months, the number 3 non-COVID exact specific one was the deaths of despair one on your most recent study at the Wellbeing Trust. So people are still interested in this stuff. It's just you end up competing with yourselves. I mean, you're competing with the other publications, but you kind of like end up, you know, frankly, cannibalizing each other. You have to, like, the paper, there is so much content. You, like, the editors literally have to kind of stagger when they release stories, or you just, and nobody ends up getting much traffic. But having a compelling story, a narrative story, a storytelling. My obesity story would not have done so well if I didn't have you know, a tragic case of a 24-year-old young woman who was in the 300-pound range. So I think it was more, I didn't say this, but I think it was super morbidly more, I don't know how many morbidlys and super it was, but to have a 24-year-old girl die of this disease, and frankly, what I thought was kind of a beautiful example of what it did to her family, and they've all got his Latina family, and they all went on a diet, and it had this great effect on them. So, you know, if you can get, and you know, I say this a lot to people, including Ben, and I mean, I heard of several things in Dr. Hathi's presentation. I'm like, oh, I think I have to find that person and that person. Like I actually used to think it was a little much when I wasn't doing this, but that's what people read. There is something called heads-up display, where we can actually see where people's eyes go in our stories, and they go to the people's stories. So just here, I'll kind of make a turn, you know, back to the beginning of, you know, one of my frustrations in the media is we have this kind of you know, gaze, like we cover something to death and then we move on, like Zika or anything like that. And I will tell you that, and so some of the things that Dr. Hathi is talking about, I mean, you can see it. It's a political thing, you know, and believe me, on that list of stories that did well, I'm, you know, sad but true, but it's when it's been about Trump, when anything it gets in there about Trump, that's what makes that's what makes them the most popular. You know, I think I didn't mention him in my the story about obesity. I didn't mention the description that came out earlier last week, but maybe that has something to do with it. I don't know. Nancy Pelosi said something about him, but when you so you have to kind of fight to continue writing about something because it's gotten so competitive. So frankly, that was what led me to start the Urban Health Media Project. It's a passion project of mine. People say it must be hard to have a passion project in a day job. I say, well, the problem is they're both my passion projects. So I'm full of passion. I wanted to get underneath like the issues that were happening, and it was Ferguson, the Ferguson unrest and violence. I think that was 4 or 5 years ago, and an African-American doctor and I were talking about, like, you know, the media doesn't cover, like, why is there so much anger in this community? So we wanted to look at the social determinants of health and those kinds of things. We got a $300,000 grant from Kellogg Foundation. We got a group of kids in Washington and Baltimore. And to just summarize, we thought they'd write about food, transportation, all of that. When you asked them what they wanted to do their projects on, it was mental health, and it was mental health, it was fatherlessness, it was domestic violence in the home, it was domestic violence at school, their girlfriends and boyfriends that, you know, that were in violent relationships. So that's the kind of stuff these young people wanted to talk about. we're getting back into some of the social determinants of health, and we're turning it more into, like, you know, there's obviously so important right now because of COVID. So all of these challenges these young people and all of us were having before are now so much worse. So I'm so happy that these young people are willing to speak up. They're not, of course, everyone wants your child to listen to their parents, but they were being told to pray, or they were punished if they said they were suicidal. These were the stories I was hearing years ago. But now they're speaking out, and they're writing, and they're telling their own stories. The young people write stories. They've contributed to several. I've done at USA Today. They've done videos. One young woman, Princiana Hudson, who I know is listening today, was written about in the Washington Post. Petulia Dvorak wrote a column about the mental health stresses for young people in Washington, D.C., and featured Princiana and the fact that she was writing about mental health, about how bad it was to be in her house with mental health challenges and addiction challenges within her home, and then as if it could get any worse, then her close friend is shot outside the door. I know Heaven, Pete, and I couldn't even believe it, that I had 2 students among 10 at that moment, and 2 of them lost close friends within 24 hours. I thought it was unbelievable it could have happened, but it just underscores the mental health challenges and the power of having these young people tell their stories. So I'd just love to segue then to Heaven Pete, because she's going to be an intern for the Urban Health Media Project this summer. So we'll all get a chance to work closely with her. And she's going to talk a little bit about how she, as somebody who, she's not positive she wants to be a journalist, but Dr. Hathi, she thinks she might want to be a doctor. So I told her that would be okay too, but she'll be a good writer if she's a doctor. So Heaven.
Hello.
Hi, Heaven.
Hi, thanks for having me. So for those who don't know, my name is Heaven P. I'm a rising senior at Coolidge High School in Northwest DC, where I'm part of the Mass Media Academy as well as the Health Science Academy. Merging the two, I recently become interested in journalism, specifically dealing with health. I just completed a workshop with the Urban Health Media Project where we learned and read about prescription drug safety, antidepressants, and mental health. As I work more with journalism, I realize media is so important, especially today where there are new discoveries, disasters, and changes happening, it seems like all the time. It's very important for the media to stay up to date with facts, especially now where most people are getting their information from like social media, and there's a lot of false news being spread there as well. A recent example of this that was especially troubling to me was when the virus first hit. People were saying that the virus didn't affect Black people and children, and I'm sure a lot of people believed this and didn't take precautions to protect themselves during this time. Then we found out that the virus did affect Black people and children, and this type of misinformation can cost most people their lives, really. And sometimes old information that has become disproven, like that the masks don't work or the children don't get COVID-19, gets recycled on the internet too. So that creates like a loophole of like, not false news because it was maybe true or believed at one point, but we now know of a different approach. And so I just want to help prevent that by being a trusted news source for my community. So to me, the media plays a big role in helping people stay safe and also remain calm during this time. But it can also be very scary because people are being informed on precautions to stay safe, as well as things to do to pass time and relax their mind. But with updates coming in every day about the virus and new facts, people can begin to feel overwhelmed, especially being out of work and worrying about not only staying safe right now, but what the future will look like given the new circumstances that many are facing. Many people are feeling lonely or depressed during this time, as you aren't really allowed out and to visit with family and friends, on top of other factors that might be going on in their life. So the Urban Health Media Project mental health workshop happened right in the middle of the pandemic. At the same time, I lost a close friend, a boy that's in my same age group that I went to school every day to gun violence. And this made me realize how serious mental health is and how important it is to get treatment when you need it. So my personal experience, when I lost my friend, I felt devastated and I kind of went into a state of depression. Dealing with the effects of COVID-19, it didn't really allow for me to be around my friends, help me cope with the pain. But at the same time, I didn't really want to. Like, I didn't want to sleep. I didn't want to eat or work or do anything. I really just wanted to lay and cry, really. It was like my world was turned upside down because there was a virus taking over the world. I was being overwhelmed with schoolwork. I was missing my family and friends. And then I had to deal with the death of my friend at the same time. And with the virus going on, a funeral arrangement is like a very different and difficult thing. This Friday, I will be attending the wake where I have to wear a mask and stand in line to view the body because only 10 people are allowed in at a time. So at a time like this, I know that it's important to have programs like the Urban Health Media Project that let me share my experience with others. It's also very important to be a part of the NAF Mass Media Academy at my school. The NAF Academy is a 4-year career education program that gives us students experience in multimedia coursework. It's shown me college and career opportunities that I would have never been able to be a part of. There are about 90,000 students in NAF Academy across the country. 98% of us will graduate from high school and 93% of us will go to college. There are over 1,000 students in NAF Academies in DC public school systems, and we tend to have higher attendance rates, GPAs, and graduation rates than other students. And so this summer, I will have a 120-hour paid internship, which I would do at the Urban Health Media Project, and I'm looking forward to putting my experience to work there and to learn more about mental health treatment and good mental health strategies, not only for myself, but my community. And my next Urban Health Media Project is reporting, researching, and writing about the effects the exposure of trauma has on people's mental and physical health. I want the community and government officials to understand that violence and grief, to understand what violence and grief is doing to our communities. As I told you, losing my friend happened right when everything else was going on with COVID. And like, I feel the media is more focused on COVID-19's effect on African American communities, which is great. And I want to help maintain that focus, but also include our mental health as well. Right now, it's a hard time for everyone, but looking on the bright side, there has never been a better time to address urban health problems in our communities, especially dealing with the youth. I know everyone will get through this, and that's pretty much it. Thanks for having me again. Thank you all for listening, and I guess I'll pass it to Dan or Jayne.
Thanks, Evan. That was phenomenal. We appreciate not only your insights into so many issues that are plaguing multiple communities, but also your leadership and your courage, being willing to stand up on a national webinar as a high school student. I couldn't even imagine doing that. And so I appreciate you doing that and appreciate the leader you're going to become for all our communities. So thank you. Dan, turning to you, my friend. We're getting a ton of questions coming in, so you guys get warmed up. But Dan, it's great to have you on, and please take it away.
Thanks so much. I'm really honored to be here and to be a part of such an important conversation. And it's wonderful that there's so many people on this webinar who really want to kind of dig in to this, because it speaks to how critical this issue is of mental health in the press. I just I just want to introduce, just for a little context, I've always found as a reporter, it's useful to give people context. I want to introduce myself to people who might know me. I've been in public radio for 20 years. Most recently, I was the healthcare reporter at the public radio business show Marketplace for 6 years, but I ended up leaving there because I found that it was too difficult to do these really critical, important health policy stories in 3 to 5 minute bites. And so the idea, oh, I forgot, there's a slideshow. Can we go to the first slide? I apologize. I'm not used to usually talking with slides. So that we can go to the next slide. So just a quick little overview of what you can expect from this quick presentation. I'm going to talk a little bit about why we need to talk about, why we in the press need to be talking about mental health coverage right now, what trade-offs is really doing, and then really how we should think about podcasts and the role that podcasts can play in the media landscape. We can go to the next slide. Thank you. So as I started to say, you know, trade-offs began in the fall of 2019 because I was really convinced that the country, after having interviewed so many different people for 6 years at Marketplace, like top people, lawmakers, employers, policymakers, there's so much misunderstanding in healthcare because it's just so complex. It seemed like it was really critical to have some sort of vehicle to help break down what our healthcare system is and what it's not, how it works, who leaves behind, who wins, who loses. And so we can go to the next slide. So what our strategy is, and it was really great to hear the presentations. It's really awesome to go at the end. Thank you for that, Ben. And I mean that. You know, as Sejal said, it's really important that people need to dig a bit, people being the media need to dig a bit deeper. Heaven was talking about the role that false news can play and how that misinformation can play itself out in people not being prepared to take care of themselves. And we also heard, just going to my notes here, like any good reporter, we also heard Jayne talking about people's stories and how important and essential people's stories are. And so what we're trying to do at Trade-Offs, and this is true for our mental health coverage, but also beyond, is how do you take data, facts, evidence, and marry those with storytelling? And I think what the trick is for media and for all the people who are on this call who are really interested in mental health, I think, and as Ben talked about at the top of this call, this webinar, if we want to move people, if we want to see action happen, what I think is necessary from the media's perspective, at least, is to begin to do stories that do, and Jayne does some of this great work, and you see it, and one of the reasons why we all know Jayne's byline is because she's able to do this, but you take data and facts and evidence and you marry it with people. That is a way to build trust with your audience and move people's hearts. And it's that combination, I think, that can lead to real meaningful change. And we're in a moment because of COVID that potentially, and we can go to the next slide, we're in a moment because of COVID where there's really an opportunity because there's so much focus, even though mental health is sort of to the side, as Sejal sort of really articulately explained, mental health is to the side. It's still there. And it's there in a way more, in my mind, mental health is more of an issue in newsrooms in America right now and more on the top of mind for most Americans than it has been at any point in the 20 years I've been a reporter, because of all the social distancing, because of the isolation, because of the terror that's going on in our country. And so, you know, we in the media need to make sure that we are getting out and telling this story. And this one bullet point, I know you're not supposed to read your slides, but this one bullet point from the Wellbeing Trust projecting the economic crisis may cause as many as 154,000 deaths of despair. The New York Times, just for history's sake, put up the 100,000 people who died. I mean, so this is more than that, right? 154,000 154,000 deaths of despair. And the thing that's sort of pernicious and tragic in my mind about the deaths of despair is that so many of them are silent. It's really hard to see and touch them. And I think that's where media has a real opportunity to play a wonderful role in shining a light and in helping underscore what is at stake, what is happening when we don't have adequate mental health services in our country. We can go to the next slide, please. I actually don't even really know what this slide's about. There's something I'm really excited to do, and it's the next slide. And it's a story I want to play a clip of an episode, a recent episode we did, because one of the things that Trade-Offs is really trying to do is, in the middle of March, we pivoted. We were doing 2 episodes a month, and then we decided we needed to do 2 episodes a week. So that's insane. We're really exhausted. We've got our own issues, and we're going to take a week off in June. But one of the reasons why we wanted to increase our coverage is because we thought one of the roles that our job is right now is to help document the experiences, the trauma, and the hardship that people are having. And so this, an example of that is this a snippet of this episode, and I'm going to set it up, and then we're going to hear a couple seconds from the story. It's about a man named Antonio Matthews, who struggled with heroin addiction since the late 80s, in and out of jail, often homeless. Last year, he ended up in his own apartment, and by August, he began getting a monthly Suboxone-like shot. By the time COVID hit, Antonio had been sober for 7 or 8 months. Then in March, he got a call from his provider saying that it was time for his next shot, and that meant he was going to have to take a packed public bus. Now, this is a man who has kidney disease, and he's much more vulnerable to getting COVID, and he was terrified. And so he didn't know what to do. He didn't know whether or not he should get on this bus or not. And so that's where we pick up the story. So if you could play the clip, please. Antonio was as sober and stable as he had been in decades, but the fear of getting the coronavirus had him thinking of turning back to his old comfort, heroin. It was an ugly choice, and it didn't sit right. Friday night, the pacing started. Antonio turning over his choices, his anxiety ratcheting up.
It got worse and worse and worse. The anxiety got really bad. I couldn't sit down for 5 seconds without my body just reacting. And I would just walk around the apartment back and forth and talking to myself. And then after a while, it got so bad that the anxiety started making me throw up. I was in bad shape.
He got so twisted in his thoughts and fears, Antonio barely slept. By Sunday, he needed some help.
At first, I was embarrassed and felt like I was weak, but after about 2 days, I started reaching out to people. I was like, I got to tell somebody what I'm going through.
Thanks for that. You can go to the next slide, please. Thank you. So, I think it's so critical that, and what's awesome about this medium is of a podcast where you're not, you don't have a certain, it doesn't matter if the story is 2 minutes or 2.5 minutes or 25 minutes. You have a lot of room and space, and you can get into these characters. And as Jayne said, you can really tell these human stories. And I think that's a big part of what needs to happen to get, there's something about the human voice, not the thing that you see on TV, but when you hear it, when it's in your ears, that it can work its way into your imagination, and you can feel there's something vivid and visceral. And we plan on doing a number of stories in the coming months. As you can see on the slides, domestic violence, behavioral health integration. We're interested in stories potentially around mental health workforce issues, the role that peer support can be playing in a time like this. These are all sort of topics that we're kicking around and excited to be digging into. We can go to the next slide. this is just a slide. This is sort of a promotional slide, but we, you know, in a way, it's really important, I think, that it speaks to, in a moment like this, in a crisis, when people are worried, they want some place where they can go and get reliable information. I'm really proud to say that our audience could see that. And we saw a real jump at a time when people weren't listening to podcasts. We saw an increase in our listenership. And I think it speaks to this model. You know, it's not necessarily magic at trade-offs. It's this idea of how do you, if we're having a conversation about the role media can play in mental health, it's how do you engender trust with your audience? And I think that's really the challenge, because everybody understands how complicated this is. So do you have enough data and facts backed up with enough humanizing context to really seal the deal? And I think that's obviously what we're going for. And a couple of salient points, I think we can go to the final slide here. Thank you. A couple salient points I want to get to, and I realize I'm just about out of time, but I just want to leave people with this about podcasts. 90 million people are listening to podcasts every month. Surveys suggest that people trust podcasts more than radio and TV news. There's some really good mental health podcasts out there, like Mental Illness Happy Hour and The Hilarious World of Depression. And that, you know, finally, we're like, pitch us. We're really open. I'd love to get pitches from us. Email me. I'd love to hear from you. We really want to get into these stories. And thank you very much. Really appreciate the time.
Thanks, Dan, and thanks to all of you. So those of you that are listening, you just heard from an amazingly well-respected journalist that he wants your pitches. And that was one of the comments that came up, is how do you get stories heard? How do you get them told? Well, I can tell you that my colleagues on this call, they expect more than just your press release. They actually want a little bit more of the insight into the story and why it matters to people. And you just heard right there from Dan that he's looking for that. And I'm sure Jayne, not to speak for you, but you're probably very open to that as well. So we got a bunch of questions that came in, and I want to try and go through a few of these before we run out of time. So I'm just going to pick these in no uncertain order, just what's popping up on my screen here, and then we'll try and get through as many as we can. And so for our panelists, one of the questions that was brought up, and I'm going to read it verbatim. COVID-19 has brought up many flaws in our healthcare system, as many of you discussed today. How do you best see healthcare professionals, the media, and policymakers interacting in the future to help mend the system? Do you anticipate a need for comprehensive reform, or will smaller efforts from each industry help unify our healthcare system? And I'll leave it to any of you to take that very wonderful question on. All right, go, Jayne, you got it.
You're on mute though, Jayne.
I thought that they were, I thought I was still being unmuted. Okay. I'd love to hear from Dan too, but I know that Ben has a dream, a plan to reimagine, or he already has reimagined how the whole system will be overhauled. And I know it involves a lot of integration. But I do think it'll be great if, I mean, I'm just a reporter. So I mean, I certainly don't know the answers, but I do think it'll be important for the media to highlight the success stories. There's a journalism program called Solutions Journalism, or there's actually a concept and something actually called Solutions Journalism. And one of the things I'm trying to do, like as Dan mentioned, we try to get the statistics and of course a trend and as much of the real person's story, but like what's working to solve that. We've been very conscious at USA Today over the last several years, because it's frankly been a criticism, of us, and I'm sure all media, that we focus too much on the negative. So I think, so to answer the question, I think that the media can highlight more solutions. It might be a big solution, but sometimes that's hard for the media to get. We're not good at those kind of big picture things. We're better at focusing, like we talked about, on Ferguson or something like that. But I do think it'd be great if we focus on a lot more of the solutions. And I'm happy to address, if there's time later, the question about like how best to pitch, because I tell that story a lot.
We'll come back to that, Jayne. That's a good one. Dan, any comments on that one?
I mean, I think Jayne said it well. I think it's a good question. It's a difficult question that has no easy answer. And I think that the role the media really can play here is in helping inform the decision makers and making sure that they're acting with the best information they have at hand. Ben, I know that's something that you've worked really hard at trying to make sure that people who have power are informed. And I think at the end of the day, you know, the people on this call have an opportunity to reach out to Jayne and myself and other reporters, because you all are the ones on the front line who have the real information, and you need to get that to us so then we can act as a conduit to get it to people, advocates, but also to direct to the policymakers themselves.
Thanks to you both. We've got a couple more questions coming in here. And just to comment, for those of you that were hoping to ask Sejal a question, she did that amazingly cool thing that physicians tend to do. She got paged. So she flew off to take care and save the next life, and is on to that. So thank you, Sejal, for what you did today. I want to read a comment, and then I want to go to another question. And this comment is a very powerful one, and it comes from a good friend and colleague from Colorado, Rick. And I'm just going to read this because it's extremely powerful. As the father who lost his 15-year-old son to suicide last year, I want to thank all of you for helping elevate this conversation. As I sit here uploading videos and photos of my son for a documentary and listen to this conversation, I cry. But I also celebrate the fact that this conversation is being elevated both locally and across the country. Thank you on behalf of my son, Jack. And thank you, Rick, for what you're doing for so many. And thanks for being a part of this today. And Dan and Jayne, I know that you all have heard stories like those that Rick have shared, and you know the importance of giving people hope and really talking about tough issues that we can pretty much can drag us down, but there are reasons to be hopeful, because now it seems like the narrative around mental health is actually being elevated, that we are having webinars, we are seeing it in headlines. And Jayne, your comment about it being one of the top articles that has been viewed says a lot about our nation's ability to grasp that. So thank you, Rick. And I'll leave it to any of you to comment on that, but I also have another question. Any comments to Rick?
A couple, just partly because it's very front of mind, because I am actually working on a story that I've been working on for way too long with students, and now trying to finish it up on Black teen suicide. And one thing that came up that I was going to mention in my remarks that I didn't realize, and I'd love to know if Dan has a policy, but a lot of my colleagues around the country, our chain owns the Des Moines Register and Milwaukee Journal Sentinel and 260 properties. A lot of them have a policy that might not be written in stone, but they're no longer using people anonymously as suicide, because if they attempted suicide or died by suicide, because that adds to the stigma. And I thought that was kind of interesting. And I hadn't really thought of it that way, because it wasn't that long ago we thought of it. We're not trying to, we certainly don't out people that don't want to be written about. But I think that's kind of an important development. And again, it goes to the point, I've had students in the past who have more than once tried to take their lives, and they've written about it, and it's very powerful.
Jayne, I don't. Thanks for that. I don't have a policy, but I appreciate that. I think one of the things that's important, and I've seen over the years seminars and whatnot from media folks where there is some training around how do you talk about suicide,
Yeah.
how do you talk about mental illness, and frankly, that there needs to be more of that, because it's really, as a reporter, these are stories that sometimes I really want to tell, but I jump back. I'm a little spooked that I might say something wrong that could end up being a trigger for people. And so, we're reporters. We're experts at being reporters. We're not necessarily experts at how you talk about mental health with the public. And so making sure that there's enough sort of training there is essential. But Rick, first of all, your comment is beautiful. Thank you. It brought tears to my eyes. I'm really sorry for your loss. And I'm really glad that you're trying to document the life of Jack. And I think that, Ben, when you talk about the positivity, I think and I know I keep saying this, but Jayne said it so well. This is about human stories, and it's about humanizing Jack and in Jack's context. And I remember when I was a reporter at New Hampshire Public Radio, and this is during the Iraq War, and there were so many soldiers coming home dead, having been killed in action. And it was really hard, but I pushed through to really try and humanize these people as much as you can. And I think that when it comes to stories of suicide and larger mental illness, the more honest the survivors, the family members, the loved ones can be, the more we're going to make up room and destigmatize these issues. And so, Rick, best of luck to you in your endeavors in your work.
And it's so important for parents to speak out as well. And there's a woman I'm still in touch with who is involved with some sort of organization that's a parents organization trying to educate parents about the importance of paying attention to some of these mental issues. And I was just going to mention one other thing that when one of the very first interviews some of the students did 3 years ago, a woman I know who happens to be Jewish, and she's a psychologist, and her mother had a therapist, so she's probably in her 50s, and she was telling the students, and it was just so unusual, like that, because she said, well, we're Jewish, we all talk about that we have therapists, and the young people thought they couldn't believe that another generation, like even older people, might have thought that was okay. And I said, no, it is very common in certain circles to talk about it, because there's nothing wrong with it. It's no different than if she had a cardiologist or something else. And the normalization is going to be so important.
Well, thank you both for that. And again, thanks for the comments and the questions that are coming in here. We're going to take one more question, and then I'm going to let Heaven, I'm going to let you have the last word here, because that's the way it should be as the future of our country. We're going to give you a minute here just to kind of close us out with your thoughts. But one more question here, and this is an important one. It's a little challenging because it's around insurance, and they remind us in their question that in 2008, George W. Bush passed the first mental health parity law that was expanded under President Obama through the ACA. Yet today, insurance companies are violating the law, and there's little to no accountability. Why doesn't the media cover this is the direct question. And I think the bigger question is there's a major issue that impacts almost everybody who has health insurance in this nation. And especially those of us that are seeking out care for mental health or addiction services, we often get denied or are paying out of pocket for services that are rightfully ours under our health insurance. So do either one of you want to talk a little bit about mental health parity or the insurance issues that plague so many of Americans?
I'd be happy to. I think that it's an important story. It's a good story to get out there. And I don't mean to make light of it, but there's some insurance is a lot of people's not favorite thing to write about. So you have to kind of break it down if you're pitching it as a story. You make sure you do, and I'll just touch on the how to pitch part, which is break it down. The average person walking around, and I probably can't define risk corridors very well right this minute because it's been a while. So whatever, like insurance issues, I covered that at the beginning in the Affordable Care Act, right at the very beginning of covering health, and I was dying to get back to people's stories. So and the reader, I will be honest, the Affordable Care Act stories I noticed don't perform particularly well. It seems like you need more of a story there. So really, if you could help people tell a story of what literally happened, there's plenty of data out there about, settlements with insurance companies and other problems that have happened. There are also plenty of treatment centers that would be happy to say how often people get, can't get their inpatient treatment approved, whatever it is that appears to be, the problem. But it's an important issue. It just needs something that one of our former editors used to say of the paper. So what and why now? Why should the average person care? I would argue because if this person doesn't get treatment, they're going to have all these other health problems, and they could end up in the criminal justice system or something else, even if you don't care. Like, of course, we all should care about each other, perhaps, I would argue. But if you don't care, it's going to cost the health system a lot more if these people don't get treatment.
Yeah, I mean, I think parody is one of those stories that sort of is always sort of bopping around in the galaxy of possible stories. But I think one of the things that's a challenge is that you need to find where's the person in the story. And so if you have a character that you can sort of follow and understand and sort of watch, like, okay, here's this person, they have a problem, they're trying to get it addressed, and then they've got the denials, and then they can back that up with, look, here's the paper record from all the denials from the insurer. Then all of a sudden it potentially becomes a story. And if you compare that with some larger data or some evidence, then I think we've got our hands on a really nice story. But it's not easy to get all those pieces, to have all those pieces fall into place. And sometimes, this is such a critical issue, but the truth is it's a hard story to get because you don't have the pieces really. You have to do a lot of digging to find a person. And sometimes reporters just don't have that kind of time because they've got a deadline that they've got a news hole they've got to fill. So if you have that story, whoever's asked this question, please reach out to Jayne, reach out to me, or reach out to another reporter to help try to make it a little bit easier. But that's part of the challenge, is like reporters they get it, but they need help.
Yeah, and if I could piggyback on that for 1 second, I noticed someone asked something similar, just about addiction, just specifically, only pitching a story about something to do with addiction treatment, less about parody. That it's pretty much the same challenge, and it's embarrassing to say sometimes. And Dan, I often will take it a little farther, and I guess I should be embarrassed that I'm saying, hey, you want this story? You got to help me find the trend. You have to help me find some data. I mean, if I need to convince my editor, already at the outset that it's a good story, particularly during COVID, with the COVID angle, that all important COVID angle, and then I have to tell her it's going to take me 2 weeks, she's not going to be interested. So, if I want to do the story and you want the story told, let's work together. And the more you can provide of the greater context, the better.
That's great. Jayne, we've got a lot of folks that are weighing in here now because you've both sparked a lot of interest here. What's the best way that people can reach you, Jayne? I think they've got Dan's email. How do you want people to get a hold of you?
J O'Donnell, JODONNELL @usatoday.com. And I'm on social media.
Awesome. Thank you. Heaven, we're coming to you in just a second to close this out, but really quickly, while we've got Jayne and Dan, in one sentence, I'm going to challenge you here. One sentence, you can have a semicolon and maybe add an additional longer sentence here. But
mine's going to be a run-on sentence. My editor needs those, but I'm doing
No run-ons. Come on. What advice would you give to people who do want to make a pitch to someone like either of you? Now, granted, I know you both and you're amazingly kind people, but you also get a lot of people that are pushing things your way. What's the one sentence or two, I'll give you that you would recommend for folks who do have a story idea that want to try and get it out there into the media?
Send me an email. Send me an email. Send me an email, comma. So look at what I write about, so you'll have some idea. And make sure you have a real person who's got a compelling story that hasn't already been on Good Morning America, and who's part of a larger trend. Help provide some of the help provide some of the data and whatever that larger trend is, period.
Thank you, Jayne. That was good. All right, Dan, beat that one.
Yeah, no, that was great. That was great, Jayne. What do I need in a pitch? Yeah, I think you at the end of the day, I think for me, particularly if it's more human than it is a policy story, then I want to understand in about a paragraph. Like I probably wouldn't read a whole long page, right? Like one bit, like you've gotten those sometimes where it's like a big long, I know, you're just like, what the, I don't have time for this, but in a paragraph, tell me your story. That's my
No
style.
long and don't call 5 minutes after you send the email and then leave a long message. Like I mean, at my age, I pick up the phone. Younger reporters never pick the phone up, and they don't listen to voicemail. So you might as well just get rid of that habit.
That's so good.
Yeah, too chatty. I can't talk to everybody on the phone, so I prefer an email.
That's so good. Well, thank you both for that. And thanks for your expertise and your leadership in this space. Heaven, we're going to come to you. We'd love for you to close us out with some words of wisdom from your perspective. Anything you want to add to close out the webinar today?
I just want to emphasize how important that mental health is, and I think that the media is doing the best that they can, but we have more work to do, and to help spread awareness about mental health and how important treatment is for it.
Great, thank you. Wise words, and thanks for being on today. Well, as mentioned at the beginning, this is recorded. All the slides will be available. We'll make sure we send it out to those of you that logged on here. On behalf of Wellbeing Trust and Civitas and my colleagues, Dan, Sejal, Jayne, and Heaven, I got it. We want to thank you for joining today. This has been a tremendous honor for me to hear from my friends and colleagues, and we wish you the best, and we will be in touch soon with our next webinar series. So thank you all. Have a great day.
Thank you.
Thank you.